way past time that mental health care must be treated the same as physical health care. It is way past time.
San Francisco leaders calling for an end to the ongoing strike by Kaiser Permanente mental health care workers. They've been on the picket line now for some 7 weeks, and they believe that it's affecting public health. Indeed, the San Francisco Board of Supervisors spent more than 2.5 hours tonight listening to the concerns of Kaiser's mental health workers. KRON 4's Amanda Harry joins us now live in the studio with more on that. Amanda?
Many of the people who spoke at the meeting are urging the supervisor to do something to get the mental health care workers off the picket lines and back into their offices. And some of the supervisors are now calling on Governor Gavin Newsom to get involved.
I just want to say to Kaiser that just because you're a giant does not mean you cannot be knocked down. And it's time for them to do the right thing.
During a hearing at their board meeting on Tuesday, many San Francisco supervisors spoke out in support of the more than 2,000 Kaiser mental health therapists currently on strike. The therapists are demanding that Kaiser fully staff its clinics and end dangerously long wait times for therapy.
At one point, early this year, the number of active patients that I, myself alone, am responsible for is over 180. That's 180 active patients. And I have about little less than 30 return appointments a week.
That clinical psychologist says he's worked at Kaiser for 21 years. Because of the current circumstances, he can only see his patients every 5 to 6 weeks. And he says that long of a wait could be deadly. Therapists also say they're seeing people's mental health issues get more serious because they can't get the treatment they need in a timely manner.
Our youth are not getting more sick. They are not being seen and being treated for mild anxiety adjustment, mild depression, social skills, things like that. And so they end up getting worse and worse.
Therapists say they want to come to a resolution with Kaiser to end the strike. Kaiser representatives were invited to the Board of Supervisors meeting, but no one showed up. The research and political director for the National Union of Healthcare Workers says he's concerned with how Kaiser is handling the strike from a patient perspective.
We've learned that Kaiser has been contacting patients to schedule appointments with clinicians who they know very well are on strike with no anticipated date of return.
Supervisor Hillary Ronen says she plans to write up a resolution for next week's meeting demanding Governor Newsom gets involved. Other supervisors want to push to get Kaiser representatives at their next meeting on the topic. Vicki, Grant.